It's called a reverse shoulder replacement, and Dr. Brandon Kohrs of Ohio's OrthoCincy let us go inside the operating room to show us how he replaces the shoulder joint. He uses the inset reverse shoulder system from Shoulder Innovations, which provided this animation.
It's called a reverse shoulder replacement because you actually switch what you're doing there. You actually put the ball where the socket used to be and the socket where the ball used to be. What that does is it actually constrains and almost turns the shoulder into a hip joint in a way, and stabilizes everything, allowing your big deltoid muscle out here to be able to lift your arm appropriately.
And boy, has it made a difference for Bill Walker.
I like to work on cars. I do. And you can't do that without both shoulders.
Now, Bill is back to working on his cars. This is one of his favorites. And wishing he'd had the procedure a whole lot sooner.
About 5 years sooner.
Dr. Kohrs told me that's a common theme among those who put off joint replacement procedures. So if you've been waiting for long-term results, here's what he wants you to know.
The midterm data on it is pretty good, and we've been really happy with how these patients have done as far as taking somebody who can't lift their arm at all because of a massive rotator cuff tear and allowing them to have good function of that shoulder.
I'm surprised how much less pain I had right away. I couldn't believe it, and yeah, and this is 5 months from tomorrow was the day I had the operation.
Dr. Kohrs says in those who do have this procedure,
and if you have horrible pathology in your shoulder, getting rid of that pathology and replacing that can provide significant pain relief right away.
Now, as with any surgery, there are risks, including that of infection and recovery with a limited range of motion. But a recent NIH study found delaying these surgeries can lead to worse outcomes.
You can always find our stories here on YouTube, but go ahead and click subscribe to get notifications and stay in the know.